Hi, my name is Jacqueline Cosgrove. I'm the health reporter at the Oklahoman. Joining me today is Commissioner Terri White of the Oklahoma Department of Mental Health and Substance Abuse Services. Thank you so much for coming to the studio.
Thank you for having me.
And we are here to talk about, unfortunately, about budget cuts. Could you just kind of help our readers understand what budget cuts you guys are facing before June 30th?
We've had 2 rounds of revenue shortfall in the state, a 3% cut to all agencies' general revenue funds and a 4% cut. That 7% total for the Department of Mental Health and Substance Abuse Services means we have been forced to rip $22.8 million out of the budget in the last few weeks of this year's budget.
Wow. And how is that translated to the low-income uninsured residents that you guys serve?
We serve about 195,000 Oklahomans a year who are in need of mental health and substance abuse services. That's already too few. That's only 1 out of every 3 people, meaning 2 out of every 3 Oklahomans who need help can't get in the door now because it's narrow. That door just got narrowed further. What that means is individuals and families who need life-saving services are going to have a more difficult time accessing those.
Wow, that's incredible to think about. What concern do you have about the impact on the progress that you've been able to make in the past few years in terms of the suicide rate, in terms of other programs? With all those cuts, I mean, you could venture to guess that things are going to get harder for families in terms of accessing services.
The mental health and substance abuse services budget has been underfunded for decades. It's not a problem that was created by the current legislature or the current governor. In fact, the current governor and the current legislature have been supportive and actually helped us to make some strides over the last few years. We are funded 46th per capita in the nation for mental health and substance abuse issues, even though we have the 2nd highest rate of mental illness in the United States. So we're way behind already. And so when we look at the progress we've made over the last few years, in the last round of budget cuts about 6 years ago, we were worried and we testified that we are afraid things like the suicide rate will increase when you take away mental health and substance abuse access. And that's exactly what happened. Over the last few years, we've been very fortunate to have suicide prevention money appropriated to us. We've worked and fired on all cylinders over the last 3 years, and we've actually been able to drive down that rate of suicide again in the state of Oklahoma. With these cuts, that progress, the progress on prescription drug abuse, the progress on diverting people from the criminal justice system, all of those gains are at risk.
Yeah, I just think about how today an Oklahoman, or maybe 2, depending on our numbers, probably died of suicide. And yeah, we always see panic over Ebola and Zika virus and things like that. And it always is striking to me that people, they don't think about that today an Oklahoman likely died of suicide.
Absolutely. 2 Oklahomans, 2 people known to Oklahomans, people who look like you and me, people who are our friends and our family, our co-workers, members of our community of faith. 2 people lost their life to suicide in Oklahoma. That's more than are going to die in car crashes on all of our roads, bridges, and highways in Oklahoma combined. Mental illness and addiction is not a nebulous concept, although I know it feels that way to some people. Mental illness and addiction are real diseases. They are real medical conditions that can absolutely be treated. Recovery is possible, but not if we take away the services that lead to that recovery.
Yeah, I think people have a hard time sometimes understanding recovery is possible because they see so many headlines where, somebody with a mental illness has done something, and they don't know that their coworker that sits next to them every day probably, has bipolar disorder, and they're just fine because they can get the care they need.
It's 1 out of every 4 of us. 1 out of every 4 Oklahomans struggles with mental illness and addiction. So it is absolutely the person sitting next to us at work. It is someone in every single one of our families. It looks like all socioeconomic statuses, all races, all ethnicities, both gender. I mean, it's everyone. And when you think about the fact that it's 1 out of every 4 of us, yet only 1/3 of the people who need help get it, it's frightening. It is the biggest public health crisis facing our state. And this disease, when left untreated, is deadly. That's when we see the negative headlines. We see people end up in the criminal justice system. We see more children in the foster care system. We see increases in suicides. We see headlines of tragic consequences where other people are hurt, whether that's the story that you all have run and that Kathy Costello has bravely told about the loss of her husband, Mark Costello, our former labor commissioner, as a result of her son and his son's untreated mental illness. Those negative headlines, they happen, but only when people don't have access to treatment. When people have access and are living a life of recovery, They're full and productive citizens just like you and I.
Yeah, I think it's important when we say untreated mental illness, causes so many of those problems. So there's been some talk of there possibly being a third revenue shortfall, and then the coming budget years aren't expected to be great.
Right.
I mean, what's left to cut for you guys?
I think this is the part that we all need to be really concerned about. Mm-hmm. The cuts that we've had to make, the cuts that we announced this morning, we are limiting services to approximately 73,000 Oklahomans who are going to have their services cut back. They're going to have the therapy they can access reduced. The services that we know make a big difference in recovery. The only programs that haven't been cut at this point are diversion programs like the mental health courts and the drug courts, our PAC teams for adults who are the most severely mentally ill, crisis centers where families and law enforcement bring people who are acutely ill in crisis and are at that moment a risk of harm to themselves or to someone else. Our suicide prevention programs and our prescription drug prevention programs. Those are the only programs that haven't been touched at this point. If there's another round of revenue shortfall and somehow we aren't protected from that, if there is another cuts for next year and the Department of Mental Health and Substance Abuse system isn't protected because that means our provider network out there, our private providers aren't protected from cuts, those programs would be at risk. They're the only things that haven't been cut at this point. And those programs are those programs that are used by the people who are the most ill, who we know not only are going to have negative consequences without help, but they're going to cost us more as taxpayers than simply providing the treatment in the first place.
Well, I think it's interesting you bring up the diversion courts, mental health court and drug court, because the cost of those courts is so much less than if you were, when I was, in the mental health court at Oklahoma County, there were 35 people in there, 35 people who are not in prison, costing up to $23,000, maybe more a year, versus how much for mental health and drug court?
$5,400 for mental health court, $5,000 for drug court.
Wow.
Yeah, whether you look at this as an issue that you want to save lives, that you want to help people be economically viable, because sick people don't earn, but well people are engaged in the workforce, or whether you look at this issue as a simple tax issue. How do we want to spend our tax dollars most efficiently and effectively? Treatment is significantly less expensive and by far has better outcomes than dealing with the consequences of not providing these services up front and paying for them through corrections, through foster care, through other areas of government.
Well, Commissioner, thank you so much for coming today. Is there anything else you want to add that I haven't asked you?
Thank you so much for talking about this issue. I think it's really important for Oklahomans to understand that the local networks they rely on, that's what's at risk. It's these local providers. Sometimes when people hear the Department of Mental Health and Substance Abuse Services, a state agency, got cut, they don't understand that what our dollars go to, because we have such few dollars in administration, are those local private providers. It is the community mental health center. It is the local substance abuse center that you call when your family needs help.
Right, I mean, you're talking about the backbone of the mental health system, the community mental health centers that we moved to when the psychiatric hospitals were closed.
Yes.
I mean, that's the whole point of the system, is those centers.
It is those community mental health centers, those substance abuse providers, and our prevention providers that are desperately working to lower our suicide rate.
Yeah. Well, thank you so much, and thank you for joining us and watching this interview.